Healthcare reform, my persuasive speech. We all know what it feels like. You go to the doctor expecting it to cost you an arm and a leg for something as simple as treating a sore throat and giving you antibiotics. But why? What are we actually paying for when we go to the doctor? Does everyone pay that much? Are you going to get answers to your most pressing questions? From what I can tell, there are many reforms necessary for our current healthcare system to make it useful and affordable. Changes must be made. The people must understand what they are actually paying for. In this speech, I would like to discuss some of the contributing factors to poor healthcare, as well as the differences between healthcare and health insurance, and a few of the possibilities for reform. First up is the contributing factors: rising cost, lack of responsibility for payment, and the insured versus the uninsured, to name a few. Rising costs. Author of American Healthcare Killed My Father, Goldhill, gave this statistic. Already, the federal government spends 8 times as much on healthcare as it does on education, 12 times what it spends on food aid to children and families, 30 times what it spends on law enforcement, 78 times what it spends on land management and conservation, 87 times the spending on water supply, and 830 times the spending on energy conservation. Lack of responsibility for payment. Who pays for our health care? Is it our insurance? Honestly, no one knows. Healthcare is inevitable. We will at some point get sick, and chances are that in our lifetime we will need catastrophic coverage. Having health insurance is a good and necessary thing in my opinion. However, we must change our perception that we do not have to pay our healthcare bill in order for the system to work. In the end, we must pay our own health bills. Insured versus uninsured. Goldhill makes another good statistic in his article about insurance. The average insured American and the average uninsured American spend very similar amounts of their own money on health care each year, $654 and $583 respectively. But they spend widely different amounts of other people's money, $3,809 and $1,103 respectively. As if these factors are not enough, the differences between what we consider health care and what we pay for in health insurance are not always obvious. The catch is that most people do not fully understand these differences. So what is the difference between health care and health insurance? Health care encompasses much more than just health insurance. By referring to health insurance as health care, we have lost sight of how important overall health is. We should be rewarding people for their good lifestyle and health-promoting behaviors, not punishing them with excessive premiums and making it hard for them to get in to see the doctor. What makes up actual health? Overall health is a combination of diet, exercise, lifestyle, and much more. But doctors do not focus on this. They like to treat the problem. Now the real question. Who is the consumer of health care? Is it companies? Is it the pharmaceutical companies? One thing is for certain. It is not the American public. We do not get choices in cost. Half the time, we aren't even told costs to compare. We are not the consumer, but we should be. Feel like the healthcare system is completely hopeless? Maybe not. Let's look at some possibilities to begin healthcare reform. However, keep in mind that Rome was not built in a day. Possible ideas for reform can be seen in income and savings, catastrophic insurance, and HSA cards. Income and savings is if we pay the majority of our own health care with our incomes and buy insurance for those expenses that we cannot foresee, then we will inevitably save more money and be more aware of what we are actually paying for with our healthcare dollars. Catastrophic insurance should replace already institutionalized insurance companies and just cover these unforeseeable costs, such as hospital visits. HSA cards should be used to cover end-of-life costs and essentially be a savings that you start when you're young to cover your end-of-life events or care. Now that I've told you about the issues with our current healthcare system, discussed the often confused differences between health care and health insurance, and looked at some possibilities for reform,